Action.
My name is Becky. I am going to show you how to insert or administer medication via the PICC line. So before that, I would make sure that I have a doctor's order. I would make sure that I would check for allergies, and I would gather my supplies. In that, I would make sure that I check in there that they don't have a heparin lock. If I do, I would also gather the supplies with that if I need to. So I'm going to enter my patient's room, knock on the door, provide for privacy. I'm going to wash my hands, introduce myself. Hi, my name is Becky. I'm going to be your student nurse. Mary, can I verify your full name and date of birth? She says her name is Mary Smith. Her birth date is 5/18/63. I verify that here with her wristband. Everything checks out. I know that you would like some medication for nausea, and she says yes. I'm going to give you some Zofran the doctor has ordered. She said okay. I'm going to give you that through your PICC line. She is verbalizing that she understands what's going to happen. So are you going to be able to hold your arm still? And she says yes. So that's good. So before that, I'm going to wash my hands. And I'm going to assess the site. So with assessing the site here, I'm just going to look at it, make sure there's no infiltration, there's no redness, there's no swelling, so everything looks good. Mary, are you having any pain anywhere through here? And she says no, so that all looks good. So I would take off my gloves, wash my hands. So in the med room, I already got dose accurate, checked my supplies, checked my book, verified that my saline flushes were not expired. I did go ahead and get dose accurate. She has an order. Mary is coming from us from a mastectomy. She rated her pain as a 4. She has a double lumen PICC line. She is getting intermittent antibiotics. That's why she has a PICC line. She rates her surgical pain as a 2 and states she is feeling sick to her stomach. That's why she would like something for nausea. So the doctor has ordered ondansetron, 4 milligrams IV push every 4 hours PRN for nausea. So I have 5 milligrams per 2 ml. So I did the math already. It comes out to 1.6 mLs. So I can see here that I'm dose accurate, 1.6.
There we go. Okay, it's in focus. Okay, go ahead.
Okay. So I checked my books already in the med room, verified that Zofran is compatible with normal saline. Also, Mary, can you verify that you have do you have any allergies? Mary says that she has allergies to morphine, which is okay because I am not giving her anything that has morphine in it. I am going to go ahead and do my 3 checks with my 5 rates. So I have Mary Smith, 5/18/1963. She has an order for ondansetron, 5 milligrams IV push every 4 hours PRN for nausea. I have Zofran 5 milligrams per 2 mLs, and I am going to give it now through her PICC line. She has not had it within the last 4 hours. I have Mary Smith. Her date of birth is 5/18/1963. She has an order for ondansetron 4 milligrams IV push every 4 hours PRN for nausea. I have 5 milligrams per 2 mLs. I calculated it out to be 1.6 mLs, and I am going to give it to her now. She has not had it within the last 4 hours. I have Mary Smith. Her birth date is 5/18/1963. She is getting ondansetron 4 milligrams IV push every 4 hours PRN for nausea. I have 5 milligrams per 2 mLs. I calculated it to be 1.6 mLs, and I'm going to give it to her now through her PICC line. She has not had it within the last 4 hours. So then I would also note that This does not have to be a diluted medication. If it would need to be diluted, I would dilute it with a 10 ml saline flush within the flush. So now I'm going to go ahead and wash my hands. Alright, and then I'm going to go ahead and unlock this, and then I'm going to wipe the end here per facility protocol, otherwise for about 30 seconds. I'm going to make sure that I get the air out of my saline. I'm going to flush here. Okay. And I'm going to alcohol. I'm going to take my medication, and then I'm going to insert this. I had looked it up, and it is to be pushed in for over 2 to 5 minutes. And while I'm inserting this over 2 to 5 minutes, I would make sure I ask my patient if she's doing okay, make sure she's tolerating it okay. For time purposes, this would be 2 to 5 minutes. And then I would take it off. I would clean it, 30 seconds. Policy every time I clean it. Connect it, and then this one would be the same as the medication. I would pulsate it over 2 to 5 minutes, or I would for what the medication was. So we'll say 2 to 5 minutes went through, and then I would pulsate it the rest of the way to make sure that all of the medication has gotten all the way through. Okay. And we'll clean the area. I'll go ahead and lock this back up. I would clean all of my supplies. Okay, I would throw this all in the garbage. I would take off my gloves. I would wash my hands. I would lower the bed, give her call light, ask her if she needed anything else, provide for safety. For a lifespan consideration, I would ask maybe for a child if she would want to watch TV, possibly have a parent in here for a distraction, for comfort. And then before leaving the room, I would wash my hands. For documenting, I would document the date, the time, my assessment, the medication that was given, how much saline I used, the technique I used, and anything else that had went on during the time that I was in the patient's room. And of course, like I said, I would wash my hands before leaving the patient's room. Thank you.